tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show, the podcast, and it is on Spreaker. Jeannie Roller is my co-host. We're also on iHeartRadio, so listen to us on that on Talk Radio. Jeannie Roller, the topic for today is patient empowerment. I think we've spent how many years doing this podcast trying to get patient empowerment, so you brought this topic up, and what do we need to discuss about this patient empowerment? I mean, in a perfect world, it should always be patient empowerment because we're the consumer. But how does that really work out for us in the long run, in the short run, and any run, Jeannie? Depending on what kind of medical facility, what kind of health care we look for and we eventually get.
Right. Well, and in patient empowerment, there's many definitions, but what we're looking at mainly today is patients being involved in not only, what care that they want, but also where they get that care, how they get that care, by whom they get that care. And that is so important. Mm-hmm. They have found that they have better patient outcomes if patients are active in their own care. And, we've read article after article about this, Cindy, and it, the medical industry puts this out, but to me, in my opinion, many of them don't practice it because they still come up with the attitude that, here are your options. This is what I chose for you. This is what you need to do, rather than, explain it to the patient and let them kind of, ask their questions and find their way to the best solution. Because I truly believe a great deal of people would choose the option that the doctor thinks is best once they have all the information. Mm-hmm. And the other thing is some insurance companies and some facilities have navigators to help patients through, the maze of medical care, because it is a lot, especially if you have a chronic disease such as cancer.
Yeah.
All the options and such, and where you could get it done and what you could get done. I mean, that's just overwhelming.
Yeah.
And, this navigator isn't supposed to make the decisions for you,
correct,
but to give you the information so that you can make it yourself, knowing all the information. And that's one thing, Cindy, that we talk about a lot, is that we're not given the information to make the decisions. That's a big thing. That informed consent is really not real informing to the patient.
And a lot of times, a lot of places, absolutely, yeah. The other thing we've talked about 100 times too is you do not know necessarily when you are thrust into some kind of especially serious condition, like you say, a chronic condition. You don't know the questions to ask. You just don't.
Right.
You don't know the questions to ask. I mean, maybe the ones to go to, and I don't say this lightly at all, is how long do I have? How serious is this? What type of cancer? And I'm just giving the examples for cancer diagnosis. I mean, nobody wants to hear that. People are still, in this day and age, petrified to hear that C word. And sometimes, Jeannie, we've talked about this also, there's different kind of patients. You and I are different kind of patients because we want the information. Some people don't. Some people, it's overwhelming for them. For the medical community to assume that we are all those patients is not accurate. It's definitely not accurate. How to go about that in each setting? I think probably just ask the question, how in depth with this is. I mean, there's ways. Doctors are brilliant people. Medical people are smart. They're very well educated. There's got to be an avenue to come up with that says, how much information do you want to know, blah, blah, blah. And I'm maybe not saying it the correct way, but to try to feel the patient out of their mind, to what their mindset is on where they are and what they really want to know and what avenue they would choose, the patient. It's difficult, but you got to have the conversation, I guess is what I'm trying to say. I'm jumbling it around, but you got to have the conversation, not just, here's the things, that's it, and, I'll see you Tuesday, make sure you get your blood work done kind of thing. And then you're
Yeah.
sitting there as the patient kind of stymied going, wait a minute, I don't know everything. And then you leave the appointment, because I've had it happen to myself. You leave the appointment, then you have 50 questions, because now you've done a little bit of research yourself, which is a lot of times labeled the worst thing you can possibly do, being the Google patient or whatever, you're going to use on your computer. So here you are now back again, and you can't get an appointment. Now you can't get an appointment, for another 2 or 3 weeks or a month or 2 months or 6 months or whatever, and you've got all these questions. Now what do you do? Kind of thing.
Right.
So there's a lot of stuff with this that's lacking. There really is. And I get it that they need more doctors in the healthcare arena, but are there other ways that we could get this information from a medical provider and not having to look it up on the internet ourselves? What's the demon in the room, if you will? That's the best approach to do this. Informed consent would be my words.
Yeah. Well, and not these articles are talking about people who do their own research, and that is not a bad thing, they say. And I totally agree with that, doing the research and knowing then the questions to possibly ask is good. I think too, like a navigator, I think there should probably be more of those type of people.
Okay.
Because not only, can they answer questions about what the hospital system or the doctor can do, but there may be support groups out there. Like there are different types of cancer support groups. There's support groups for just about every kind of ailment, illness, whatever out there. And, some people do well being involved in support groups that, because they have people that are going through the same thing. And the big thing is that they have found that people who are empowered, patients who are empowered, are likely to have better outcomes than patients who just go through the whole thing confused and unsure, because there's a lot of worry and stress in that. So I think that if you know and have that information, then whether it's good or bad, you can deal with it in your way.
Yeah.
And they can help you find the sources to possibly help you deal with it too. So I see patient empowerment in this as only being positive. And I think, they should screen and find out, what type of patient are you? Do you want to know everything? Do you only want to know certain things, or do you want to know nothing?
Yeah, there's got to be.
Sure that
there's got to be questions that you collectively out there in the healthcare arena could ask that would discern what the type of patient is. I mean, they have all kinds of testing for all kinds of other stuff. I mean, do we need something else? But I don't know. I'm just thinking that. And you bring up a good point. Those support groups pre-surgery or pre-procedure or whatever are really, I was involved with one with a procedure and stuff that I had, and mine was after the fact. So I was trying to, quell the PTSD and all that kind of stuff. But people would ask some really good questions about what kind of drugs did they use? What were your reactions? Did they give you any alternatives? And it was a lot of information like that was hands-on from people that had gone through similar or exact type of procedures. And it gave me a lot of information of what hopefully it didn't happen the next time. But if it did, this is where I would lean to. So that's really a wealth of information. It is. Totally, it is. That's a good point with the the navigation and whatever. But you can do, and there's support groups for a lot of this stuff. There really are, and you're talking with your peers, so you're not kind of afraid to ask the question where maybe you're a little bit more intimidated in the medical setting because it's rush, and you only got a couple of seconds and blah 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 kind of a thing, and you're already antsy being in the, in the patient seat, if you will, then this is a little bit more laid back. I know that I learned a lot, and I helped a lot. I helped to give information for a lot of people that I possibly could as well. So, patient empowerment is a big deal, and you do better with it. You honestly do better with it. On that note, stay listening to Evergreen Media Network.